Welcome to Tech Talks, everyone. We're so excited to have you all here. Andrea Genovesi is going to be discussing the 2024 PPRP Assessment Field Test. These are going to be lessons learned for managers from administering a national survey. And I will be joining the presentation a little bit later to also discuss some lessons learned. As a reminder, the monthly challenge for April was to review 2024 Tech Talks from our YouTube playlist. And the reason for this is that the first four actually are devoted to PPRP to help you out with data collection processes. So I'll have Jane throw the link from the EDC website to those playlists in the chat. And with that, just also a note that we have a ton of content to get through today, and we may not be able to take any questions, but please feel free to reach out to your EDC TA with any comments or questions that you might have. And with that, I'm going to turn it straight over to Andrea.
Thanks, Jane. All right, can everyone see the slides before I launch?
Yes, I can see it.
Thank you. Okay, thanks everyone for joining us today. There's a lot to go over because there was a lot of lessons that we learned, and that's what this talk is about, lessons learned for managers from administering national surveys. And the EDC, you can see it here, and many of you might be aware of that we have almost 20 years of experience surveying on a national level. So before we get into those lessons learned, just wanted to remind people what the purpose of a survey field test is. And the primary purpose is so that you can evaluate your administrative procedures. And because of that, the field test states they understood this and they were defaulted to the EDC process, meaning we send all of their communications other than the pre-notice and the supplemental reminder. And that's so that we could improve our processes and do a bunch of analytics to help all of you. And then as a secondary purpose is we also evaluated the survey items on the back end, and that was mostly Patty and Jane Lowe as our data managers. All right, so you've heard of the EMSC program definition and term. Well, it's still the same. However, for the messaging to our target audience, we're using the term EMS and fire rescue agencies. However, we're still using the EMSC program definition. So just wanted to let you know that. So let's get into those now, lessons that we learned. And there's 6 main lessons that we learned. Let's talk about the first one, and that's the strategic survey deployment plan. As I already mentioned, we have a ton of experience doing national surveys, and through that and the research we've done is there's a science to the frequency, timing, and number of emails. And this is a great resource from Dr. Don Dillman, who we've worked with. And based on that information and our experience, we created strategic plans for the managers. We have one for the EDC-led process and one for the state-led process. And your EDC TA person sent you the appropriate plan based on which process you're using for the PPRP. So let's get in more so to the field test and what we learned. As you can see in this little graph here on the right, and we give great thanks to Patty because she had created these so we can monitor the data. But what we could see is, once again, Tuesdays and Wednesdays were the best days for sending those communications. And we say that because research shows that, especially when you have an emailed survey, people are more likely to complete it right after getting the email. We also then looked at what time of day they were completing the assessment. And since almost all of the agencies were on the East Coast time, is really easy to analyze. And as you can see, it's between 8 and 9 a.m. And it's also in that graph there. And what it shows is the afternoon is almost like a dead zone. So don't send any communications after that 1 or 2 o'clock, that 1 o'clock time. And then this also aligns with research that Dr. Dillman has done, but also the lessons that we've learned from the EMS for Children survey with agencies, and Braden presented those results at last year's grantee meeting. However, there was a really big lesson that we learned, and you can have this great strategic plan. However, you want to avoid sending something, like your communications, if something big or significant is happening in your state. that would affect emergency services. And I'm saying that in this lesson learned because our target audience is emergency services. And here's to show you how we came about learning that is Patty created a great graph showing the number of responses each day. And then we put on there when each of the communications was sent. So you can see, you know, the bumps with those. However, they weren't as high as at least I was expecting them to be when each of those communications went out. And I knew there was a lot of crazy weather this winter. It was a really heavy winter on the East Coast. So did research and looked at exactly when those storms were. And it was pretty much storms the entire time, but there were 4 significant ones. And happenstance is that they occurred pretty much when we had every single one of the initial communications. And as you can see, it really affected the response rates. Like, for example, that first reminder nosedived right afterwards. And then also the invitation, it's actually transposed to how that bar usually looks. And the day that we launched was January 9th. And this is what it looked like for Eric and Greg in those states. They had state of emergency going on, mass flooding, everything. So the big lesson is if you have something going on in your state, whether natural disaster, other things like that, EMS conference that everyone's at, and it corresponds with one of the dates in the strategic plan, you'll want to change when you send those communications. And you can just let Braden and myself know if something like that happens. All right, so second lesson learned, and this is about messaging. So messaging, we know all about branding, and there is a logo for the PPRP, which is here. And then we worked with Emily's group to create a banner for us that we could use on the email communications with the logo on it, but also with EMS and fire images to help get across that message. And speaking of branding, we almost have been too successful with our branding because one lesson that we learned, and this is a big thanks to Patty Schmuel, is that when the pre-notice went out and even the invitation, a bunch of those people had been used to going to the website, the survey website for the EMS for Children survey. So they were just going there, even though it was the wrong website. So Patty, I didn't even think about it. She looked at the analytics, saw all those hits. So we added wording now that's on that website that directs people to the correct website. Part of that branding is the from name. And with Constant Contact, we can say we can designate who it looks like it comes from. And since this is coming from the PPRP, we could put that there because it's also with that whole branding and messaging. Also from the EMS for Children survey in the field test, we learned what the frequently asked questions are from agencies about the assessment. So we put the answers here. And for example, it says, if your agency name's grayed out, it means somebody at your agency already completed it. If your agency name is missing, contact your manager. If you need a copy of your gap report, contact your manager because the managers are able to print the gap report through the CLEM system. And then also, if you don't know who your manager is, click here and you can find them. So this can at least answer those main questions that we get, and we'll answer them right away so there's no delay. Messaging with the templates. We created templates, and when I say we, I mean the PPRP entire steering committee was a part of it, and it was all about consistent messaging and how they wanted things said. So that's why everyone has templates they have to use. And then also part of that is just letting respondents know, or I should say agencies know, who the organizations are, and specifically pulled out the pre-hospital related organizations. As part of the messaging, also targeting through segmenting is really important. And we've gotten lots of questions about this because it was brand new, and I'll go a little bit more into why we segmented later. But here's an example from the first reminder template, and you can see the letters are pretty much the same. They're very similar. But one of the some of the things we were hearing from the fire rescue agencies is as soon as they saw that EMS, they were like, oh, it doesn't apply to us. And then also is, oh, I don't transport, so it doesn't apply to me. So you'll see in the fire version, it only says fire rescue agencies. And then also it says, even if you don't transport, this survey applies to you, or this assessment. And I already mentioned this is what we learned from the NPRP as well as the EMS for Children survey is that one of the main questions we get is, oh, my agency's not there. So we now gray it out and say survey taken once a survey has been completed 100% and submitted. Another lesson learned is people were concerned if we got their responses. Hey, I've completed the assessment. Did you get my responses? So we now have a confirmation email. It's very basic. It goes out to the system. It says dear and inputs their name in and then thanks them and then confirms that we got their answers for blank agency located in blank state. And then there's some resources and also again, hey, if you need a copy of your gap report, contact your manager. And then at the very end, it's notifying them that they have not been subscribed to any email service so that they don't have to fear about that. All right, so now let's talk about the lessons we learned through the email marketing service and analytics. And potentially with the PPRP, EDC could have been sending up to 16,000 emails for every single communication, and ideally to get that set in one day. So what is your daily limit? Do you even know what your daily limit is? We knew what ours was because a lesson learned from the EMS for Children survey is it would take us almost a week to get, for example, all of the invitations sent because of that daily limit. So we knew we needed something different. So that's why we went with Constant Contact, or I should say an email marketing service. And this is not a promotion of Constant Contact. It's just simply the university had a contract with them and they met HIPAA requirements that we had. So, and this is a shout out to Emily Lemiska of a big lesson learned that thankfully she told us about this before we even did the field test, is that it's important to do authentication. So if you're using an email marketing service, you'll want to do that. And why that's important, and it's a step through IT, is what it does is it labels that your email is not phishing or a spoof, and that ensures that your email is more likely to get through to your contacts. So people who've had problems in the past probably have not gone through that step. Also, when we used Outlook in the past, we knew who bounced back, but we didn't know why. But also we didn't know who opened emails or who clicked on the links. And by using an email marketing service, we finally had those analytics. So, and what we found out, I'll go into the open and click, but what we found out is essentially bounce backs and especially blocks was not an issue. Only 0.2% were blocked, which was actually a single email. All right, so let's talk about campaigns to segment. And what we learned earlier is the time of day it arrives in their inbox is important. So we had already segmented based on time zone. And we've done that for the EMS for Children survey because last data collection for that, we used Constant Contact, partly as a beta to test. But also we had all these analytics on the open rate and click rate. And we looked at lots of different things. And the only significant difference we saw is if they had fire, the word fire, fire department, FD, VFD, things like that, anywhere in the agency name, those agencies were 2 times less likely to open the emails. And if they opened the emails, they were 4 times less likely to click on the link and less likely than their EMS counterparts. So what we did is, since we could do this dynamically throughout the field test, meaning we got those analytics as soon as the communication sent out, we found those, and then we worked with Red Flash, who has, you know, decades of experience communicating to this group, and they helped us to write templates that were fire-based with wording and things like that. And that's why we segmented between those two. And as I already showed you, there's not much difference between the two. Also, as part of that is how do you get people to open emails or click on things, like on the internet, and it's called, you want to make it clickbait. And so how do we do that? So what we did is similar to what email marketing services use, or just marketing services in general, is we used AI and the content of the letters to generate clickbaitable subject lines. And then we didn't just leave it at that. Then we went back to Red Flash to help us adjust those, because AI is only so good. And then what we did is we chose what we thought were the best ones, and we had several for each communication. And then we tested those as part of the field test to see which ones had the best click rate and the best open rates. And that's how we decided. And that's why in the instructions we sent you all, there's very specific subject lines. All right. So those are the lessons we learned about that. But what are the lessons we learned about the email templates? Well, through our experience, we learned that there's a science to the length, what you include and not include in the content. And all of this is covered in Dillman's book, in case you're interested. And I mean, it's pretty much our Bible here at the EDC. Also, the length, this is pretty easy and to know, is shorter is better. We all prefer shorter emails. However, it is good to vary the length, and that's why you'll see them of different lengths, meaning the templates. And then also, like I said, what to include and not to include. For example, in that first reminder, it's important you include the respondents because you're also thanking them and creating a social contract. And then also, don't include the deadline until the final reminder. So with the content too, the order in which the content is in there is really important, as well as vary the phrasing of how you say it. So that's also really important and improves response rates. So we actually had some very specific lessons we learned from the field test, and that was that the pre-notice was super important. And the reason is it gave a last minute email validation. And I've already heard from some people like Anna before this say it was great because then I found out emails that weren't working so that she can fix those before the invitation goes out. Also, then it's making sure that people have that right link, meaning that they're not going to the EMS for Children survey location. And then also tech issues. We've already had a couple managers, because the pre-notice went out yesterday, that had tech issues and were unable to send. So they're working through those and we're helping them with those. So that's why the pre-notice is so important. All right, so let's move on to lesson learned number 5, and that is manager contributions. We already knew that the managers are super important to this process, and we do listen to you. So what was great is we had several states, as you can see here, who helped us a lot with the processes and the templates, every part of what we developed. So here's an example of one, is that including in the pre-notice, which is sent by managers, saying if you haven't received the invitation by this date, and this is more applicable to the EDC-led process, but it's still important, that you check your junk or spam mail. And the reason why that's important is if they open that find it in their junk or spam mail, and or move it to their inbox, they're more likely in the future to get the future communications in the regular inbox. So that's why we have that in there. And then another one is just saying, like, for example, in the pre-notice, I have you listed as the contact. If you're not it, let me know who the correct contact is for your agency. And then also, hey, there's 3 questions that are going to ask you data. Here's what they are to help you prepare, meaning the respondent. And then this one's for the supplemental reminder, which is only for the EDC-led process. And it's saying you should have received these previous emails from the PPRP project. If not, please check your spam or junk mail. Once again, it's trying to get them to move them into the regular inbox for future communications. And then Eric actually had a lot of experience using Constant Contact before in his state. And he said, What we found is when you use an email marketing service, they have a secondary subject line. And if they put sent on behalf of OEMS, because that's where he's located, it made sure they opened the email. And so equivalent of that is if you have a secondary subject line, if you can put, if you're not with the OEMS, if you put something like sent on behalf of the state EMSC program, it just gives further credibility to your communications.
Andrea, you've got about 9 minutes left.
Okay. And then if you can get fire organizations to endorse and be part of the communication, it will increase your participation. And that's specifically shared with us from Greg. And then one thing that we owe a big thanks to Eric, Fatima, and Greg is they kept diligent promotion logs of everything they did, because what we wanted to do was overlay it with the data and responses. So after the field test ended, they sent us their promotion logs. We gave them Patty Schmuel, our data manager, and she overlaid them. And we saw the most significant response rate impact followed live state Q&A sessions with agencies. So that appears to be very impactful in really increasing response rates. So ideas for yourself for how to promote. All right, so now we're on to the last lesson learned, not the less. Now Jane's going to get mad at me. And I'm going to hand the time over to Jane, and she's going to talk about what we learned through the telephone calling.
Thanks so much, Andrea. Telephone calling to non-responding agencies is a practice that many of us are familiar with from past assessments and surveys. And we know that reaching out directly by phone has helped to increase national response rates by as much as 10%. So I'm going to talk about some things that we've learned from the field test and other assessments that can help to improve the quality of our phone calling to EMS and fire rescue agencies, and hopefully increase response. So remember that whether you're using the state-led process or EDC-led process, you can request phone call support from the EDC with our phone call help request form. And I'm going to have Jane put that link in the chat for you. As the EDC resources allow, we will start phone calling non-responding agencies sometime in early June for states that have requested support. Next slide. So whether it's you or someone else from your program that's helping to make phone calls, it is important to set the stage. The EDC has created phone calling scripts and tracking sheets and follow-up email templates to support you in these efforts and to ensure consistency with the message we're trying to get across, especially in the very few short minutes you may have on the phone with an agency. Your EDC TA will be sending this information out to you shortly after the PPRP launches next week. And before you get started with phone calling, remember that we want to be able to give our full attention to the person that we're speaking with on the phone. So try to secure a location in a very quiet environment with few or no distractions. This means that you should close out of any unnecessary windows on your computer or silence your cell phone from interruptions. A clean work environment can also create a sense of calm. If we're stressed, it can be felt over the phone, and your body language can also be perceived over the phone. So wear comfortable clothing. Sit upright to maximize the volume of your voice, speak as clearly as possible, and then smile while you're talking. You'll be amazed at how professional you're going to sound, especially when you smile. Next slide. Something else we've learned is that the early bird really does get the word out. Try to set aside a specific time early in the week for phone calling, and make sure your phone calls are early in the day local time. Just like Andrea mentioned with email, Tuesday and Wednesday appear to be kind of a sweet spot for phone calling. The time it takes for phone calls can also vary between about 5 to 15 minutes per call. And that depends on whether or not you're leaving a voice message or if you talk to a person who asks questions. Either way, between 8 to 11 a.m. local time seems to be a good time for phone calling at the beginning of someone's day. As the day wears on, other priorities and distractions impact your ability to connect with an actual person. But remember, you can always leave voicemail, or hopefully you can leave a voicemail. Also remember that it's important to be early with appreciation. Phone calling is an opportunity to thank an agency for the work that they do and for their interest or support of pediatric readiness. So personalize it if you can and say something like, You know, as a parent, I really appreciate all you do for kids. And just a little bit of gratitude can go a long, long way. Next slide. Phone calling also allows you the chance to leave a great impression about your EMSC program. We've noticed that when we tell someone which state and program we're from, people perk up. So for example, if I want to introduce myself, I might say, hi, my name is Jane Ostler with the Utah State EMS for Children program. It really gets people's attention. There's even something about saying the word state that carries with it a level of authority. So say Nevada State, Virginia State, Texas State EMS for Children program. Say the name followed by state. Also remember that titles matter. If someone is a chief, say, is Chief Hernandez available to speak with instead of is David available to speak with? It carries a little different tone there. It's a show of respect and it tells the person you have official business to discuss. Also, never miss an opportunity to educate someone about the PPRP assessment or project. Even if it's the person on call who happened to answer the phone, let them know that the EMS and fire rescue agencies across the state are participating in the PPRP assessment. You can also remind them that they will get a gap report detailing the pediatric readiness of their agency, as well as resources for participating. You can also invite them to check out more information at emspedsready.org. Then if you send a follow-up email, say to like the chief, you can mention that you already spoke with a member of their staff. And it's a great way to get those two talking and keep the interest going. If you do have to leave a message, make sure that you clear your voice a couple of times while you leave it. So kind of like a or a little bit of a cough. This will make you sound more human and less like a recording. Tell them that they can reach out to you on your direct line and give them your phone number. This makes the message even more personal and likely that they'll want to respond to you. Next slide. And once you finish with a phone call, you can record your interaction on the tracking sheet that we provide for you. This sheet is just for you and your records and your purposes, and it includes areas to record the date, whether or not you spoke with an actual person, left a voice message, and a detail section for notes about things you learn or want to follow up on. So for example, if you learn that there's a new chief and are given a new name or email address, you can update that right away in Clems. And in addition, make sure that you follow up quickly after phone calls or voice messages with a follow-up email. Me personally, I send a follow-up email to everyone, whether or not I spoke to an actual person. And the templates that we provide you for that can help you to do it quickly. You can even copy and paste an email template into a new signature line in Outlook so that the information is just a click away instead of copying and pasting things between documents. That'll really save you some time. So reach out to your EDCTA and they can teach you how to do that if you don't know already. Also, be sure to update Clems with any new or relevant information you get so that the next communication gets to the correct person. And finally, just remember that you can always go to the response rate and detailed dashboards in Tableau to check your progress and see how your state is doing. We just want to express our sincere appreciation for all that you're doing for this data collection period and are super excited to help you throughout this process. So please reach out to your EDCTA anytime with any questions that you have. And now I'm going to just turn it back over to Andrea.
Thanks, Jane. So we wanted to end though with a thanks. Thanks to all of you, but especially to those who have helped us with the field test. And I got Greg Edwards' permission to use this. He sent this very sweet email to us. I'll read a section of it. It said, "The EDC, please accept my sincere appreciation for your help and support before and throughout the assessment period. I heard many positive comments from North Carolina EMS agencies about the assessment opportunity and gap report specifically. So I know there's a lot of concern, and rightly so, about how it's being received, but it is being received well. And you can see that in the report that Rachel had me send out just a couple minutes ago. And just like to end and recognize our fantastic partners for the field test. This is Fatima, Greg, Eric, and then CNMI. We didn't have a photograph of them. So thank you everyone for all your help.